speaker and a YouTuber. He founded DAMS. He's a teleradiology provider, and he has this app called eMedicoz. He, of course, has written many radiology as well as non-radiology books, including the radiology textbook for medical students and non-fiction books like Fire in the Belly and Leap of Faith. And Sumer, I certainly would want to look into these two. I didn't know that he had written non-fiction books as well. These look really interesting. He's a blogger, and sumerdoc.com, I think, was the original version, and now it's indianradiology.com. It's one of the leading medical blogs, not just in India, but across the world. And he's been a TEDx speaker and is a prominent YouTuber. You can, most of you must have seen his videos on YouTube. Some of them have received like thousands and lakhs of views. And mostly he speaks not just on radiology, but also on medical education and on innovation. So it's indeed a pleasure to have Sumer on board here. He's going to speak on his story and on entrepreneurship. And he's going to, essentially answer all the questions that you have on how to start a practice, what can we do to become, more successful, both in the radiology and beyond radiology arenas. And to co-host this session, I have with me Dr. Varun Tyagi. So Varun is my colleague in Tata. He's assistant professor in Tata Memorial. And he also has his own center. And he's done some really phenomenal and innovative things in the center itself, apart from, of course, in our department. So it's a pleasure to have you, Varun, in co-hosting this session.
Yeah, thank you, sir.
So now, without further ado, I'm going to hand it over to Sumer. Welcome once again, Sumer, and eagerly looking forward to this.
Thank you, Akshay. It has been a pleasure to hear you, and it has been a pleasure to see the attendance and the number of people interested in becoming entrepreneur today is actually, I think, massive today, looking at the number of the audience. And I would like to start off by, talking about it in a very common language, in a language that everybody would understand. I will not, hide behind technical words like, equity, raising fund and everything. I'll try to keep it very simple and very, very, down to earth. That has been my approach. Like, we've done a small Google survey before we started this session, and that was the brainchild of Dr. Akshay. And that, we do why don't we get some questions from the audience? And we got a lot of interesting questions, right from, I want to start a bakery service and I am a radiologist, to I want to open a center, to can I do something other than radiology? And there we saw a huge number of questions which had a lot of variety in it, and we saw a lot of questions with a lot of confusion on it as well. Like some of them had like questions which were unrelated to what we were talking about, but we will try to take all of them in this meeting today. And I would first of all would want to appreciate this initiative by Ref and Tata, where they are talking about things other than radiology as well. I'm so happy that such a talk is happening in a radiology platform. Now let us start by the first thing. The first thing is, have you ever wondered that why doctors, why less number of doctors become entrepreneurs? Have you ever wondered that, is that a question that comes to your mind, that, is it like, and I want to answer this question with a question that we got from the form. There was a student who said, can you give us detailed steps of, an audience member had asked, can you give us detailed steps of becoming an entrepreneur? So I thought, let's understand the first thing, that there is no syllabus here. This is not like, so let me just share a quick slide here. And I hope all of you are able to see my slide. I'll just make it.
We can.
Okay, I'll just make it full screen. Okay, great. So this is what, I was talking about, the questions. I'll come to them, but the key here is there's no syllabus, no guidelines. And this is something that I believe that why doctors are not becoming entrepreneurs is because we are coming from a very rigid academic kind of upbringing. Now, the difference is that when you train to become a doctor, the difference is that in medicine, we need to be adherent to the guidelines. We always have a syllabus to follow, and we keep following it step by step all the time. And here we are looking at a scenario where you need to innovate, you need to go against the dictum, and you need to go out of the box. Let me explain. Now, imagine if you're treating a patient, you need to follow what is the knowledge available in the world in terms of the trials and the journals and the articles, and you need to follow that kind of line. It is like a rigid system. And if you are too much of an innovator in that kind of scenario, you might actually do errors because you don't have the experience that the entire amount of data and the trials would be bringing to a picture. So as a doctor, we tend to follow the guidelines, we tend to follow the box, we tend to follow the rules. And what happens is when we have to think like an entrepreneur, we need to go out of the box. And these are two separate lines sometimes. But I'll try to draw the parallel for you. And sometimes what happens is we don't see it and we miss out on an opportunity which is sitting in front of us. Now, why should you talk about this? Now, my understanding of this entire my own journey as an entrepreneur, when I started as a medical graduate, just like all of you, around 2 decades back, and more than 2 decades, and I had no idea that I wanted to become an entrepreneur. I wanted to, do my MBBS to the best of my ability. Then I did my MD radiology. I worked as a consultant radiologist for a decade, and it's like I've seen a lot of world. So what I will share with you is what I've learned out of my own experience. When I talk about entrepreneurship and when I talk about my own experience, a lot of people would come and ask me, where did you do your MBA from? And I have to tell them that, I have not done any MBA. I have not taken a business degree. It is like I've learned it on the street. I've learned it by doing it. And that is the kind of, experience that I want to share with you. Now, one of the questions that we all need to answer is, and this question is central to the understanding that we all have limited time on this planet. If we, if somebody had no idea about it in this last wave and the pandemic, we have all learned this the hard way, that our human life and existence is fragile, and you have less time on the planet, and you need to, find out what you want to use that time for. And I have seen that there are two kinds of people. There are people who are desirous of a micro person-to-person impact. Like, suppose you are as a doctor treating a patient, or as a radiologist, you're reporting an MRI. Now, when you report the MRI of a patient with disc extrusion and he gets operated upon, now this impact is limited to that person's life and the people connected to that person. Like if you report it correctly, if it has surgical implications, it would impact the life of patient, his family, and that is the kind of impact that you see. But some of us would seek a macro impact. And we also had a question in the Google form also, that somebody was asking about civil services and all those. So let us take it in a more broad picture. The broad picture here is the macro impact. Macro impact means, suppose you're an administrator, you're a researcher, you're an entrepreneur, or you are a leader. Now what will happen is your decisions and your steps that you take would have a more macro impact on the society. Like, for example, you're an administrator, you decide something that, okay, this is how the vaccination protocol in India will be. And you will find that lives of more people will be impacted rather than just one. Or, for example, if you're an entrepreneur, you will create employment, you would create an innovative solution to the problems existing. So this is the kind of introspection you need to do. And I wanted to answer this question because many people had asked, why should I become an entrepreneur? So there's no why to it. It is about how you want to spend your time on the planet. What do you want to do in this time that you have? And this time would run. Like, I still remember, like, it seems like yesterday that I was in school, and today, it is, the years are passing. It was just yesterday when the COVID, first we heard of COVID starting in China, and today it's already 2 years down the line. Time flies. And we need to we need to honor our own time on the planet. And if you honor it, you would find ways, and you would find reasons of existence larger than the mundane, like I'm doing a job to earn my livelihood. You would find a purpose larger than that, and you'll think of things like legacy. What do you want to leave behind? what do you want to do? So that is the kind of impact I'm talking about, and that is what I would try to, you know, get into you. Now, so let's go step by step into it's like, you know, I've been, you know, thinking a lot about, you know, what it takes to become an entrepreneur, and I keep seeing you know, students and, you know, business people and everybody talking about ideas. Now I'll give you my 2 points into it. That 10 years back I was in a radiology conference and I was talking about I think some academic event, and I was talking about something, and one of the radiologists senior to me walks up to me and he says, Sumer, you're doing good work with dams. I said, thank you, sir. It is honor that you know about me. And he said, I thought about this, that there will be need for PG coaching even before you did. I thought about this 10 years earlier than you did. I said, good. So what I want you to know is that like people give too much emphasis on ideas. Like, but my feeling here is that, like, today you can think about hundreds and millions of ideas today, but are you ready to make it your life? So I give much less importance to ideas. I give more importance to implementation, more importance to execution. And that is what is, you know, becoming an entrepreneur. Entrepreneur is a person who can see a vision, see an idea, and bring it in existence. Okay, so you need to create it. So just that you have a brilliant idea but you're doing nothing about it really doesn't make sense to me. And second thing that I've seen is I've seen people being very secretive about their business ideas. And you know, some people, they treat like a small business idea like I'm like, maybe he's planning to open a diagnostic center in a city, and he's so secretive about it because, you know, he thinks that if he speaks it out, someone else will do it. But he doesn't understand, even if you don't speak it out, then also someone else can do it. So it is all my way of ideas is, if I have an idea, and until today in DAMS, in the eMedicoz team, if I have an idea that we want to implement, I pitch it to my the operations team, my finance team. I keep presenting to them, and I keep, you know, getting their feedback on it. Because when I'm presenting to them, I'm actually trying to understand how the audience, how the users would actually feel like later on. So I'm like, my way of ideas is I am very open about it. Like many times in a conference or an event, like when we talk about entrepreneurship, a lot of people would come with a question to me, and I'm very open about telling that, okay, if you do it like this, this is the way it should work. So ideas are aplenty. There are so many ideas in the world, and you yourself have so many ideas. But the key is, are you ready to make one of those your life? Or is it just an idea for you? It's very important to understand. Like some people would come and say, sir, I like food. I say, do you like eating food, or do you want to make it a career and, you know, you want to open a restaurant, or you want to open a specialty food chain? What do you really want to do? Are you really passionate about it, or it is just an idea, one of the ideas for you? So in our human life, in our entirety of life, we have so many ideas. Like, and I'm being very candid today that other than the successful ideas that I have talked about today, I started a company called as DAMS, and we've now at 250 centers across the country, and I've grown it organically totally throughout our own efforts. And I've started an e-learning app called as eMedicoz, which has now around 4 lakh downloads. So other than this, but this is what, you know, I would talk about most of the time. Other than this, I have actually worked on maybe 30-40 ideas, 30-40 business ideas in the past. I've, you know, done some of them as part implementation. Some of them I have stopped at the idea level. But you know, then some point of your life you realize, okay, this is not what I want to live with, because I know the time is limited. I don't want to live with, you know, the entirety, you know, my entirety of my remaining time doing X or Y. And you need to find what is it that makes you feel the best about you. And for me, you know, this has been the way I make my decisions. And that is why I asked Akshay to, you know, name today's session as the leap of faith. Now, what do I mean by leap of faith is, like all of us have at different times in our lives taken, you know, a leap of faith. Like, you know, you meet a girl and you like, you meet a boy or a girl, you know, based on, you know, wherever you are, like, so you find someone interesting, you want to talk to them, you take a leap of faith and you say, hello, I want to talk to you. You take the leap of faith and it is your choice. If you don't say hello, the moment passes, the relationship doesn't form. Similarly, you know, many of us took this leap of faith when we decided to become a radiologist. You know, internship, somebody asked you, what do you want to become? You went into the radiology department, you felt good about it, you said, I want to do it. Similarly, when we get into business, there has to be something that really feels, you feel good about yourself doing it. And it has taken me my own time, and a lot of youngsters I meet today, and some of them, they come to me in the MBBS final years and they say, sir, I want to leave MBBS. I want you to hear this story. A boy comes to me who's doing his MBBS final year. He comes to me, says, I want to drop out of MBBS and I want to start a health technology startup, and you know, I'm looking for fund. I said, it is just 6 months for your exam. Why don't you finish your MBBS also? Well, what is the harm in finishing a degree? And he said, no, sir, I want to become an entrepreneur. And I have heard that people who drop out of the college make better entrepreneur. I said, you know, there would be people who might agree to you, but, you know, being from a good academic background, I've been a all India topper at my own stages. And when you're 6 months away from a degree, what is the hurry to drop it out? You can do both the things parallel. And I have, for the vast majority of my time in the last 2 decades, for the first half, I've been doing multitasking. I've been working in a hospital as a consultant. I've been doing my, entrepreneur stint, and I was kind of multitasking. And then I realized that I feel best about myself when I'm teaching, or I feel best about myself when I'm sharing knowledge. And that is where I took the call that, okay, I would reduce the radiology part, and I removed the ultrasound, which was requiring more one-on-one time, and I came down to teleradiology so that I could spend more time on what I feel good about things. So there are so many ideas. No, like, you know, one of my friends says, yaar Sumer, I think aajkal na, if I open a restaurant, वो बहुत बढ़िया रहेगा. मैं कहता हूँ बढ़िया रहेगा, लेकिन मेरे लिए बढ़िया रहेगा मुझे नहीं पता. You understand? There are so many ideas which might be good, which might be brilliant ideas, but is it for you? And you know, a lot of times when we started AIIMS, a lot of people came to me and said, why don't you start coaching for school students also? I said, this is not what I want to do. I feel good about teaching doctors. It may be a brilliant idea to do. It may earn me a lot of money, but that is not what I am seeking. What I'm seeking is, that my connect. I want to be in a zone where I resonate maximum, and I'm able to create maximum out of it, is where, you know, where I feel strongly about. So that is one thing I want all of you to know, that there will be, you know, billions of ideas, but you need only one that you really want to make your life. Okay. Now, once we are, you know, on the idea level, now, you know, a lot of people keep thinking that innovation happens because of the famous school thing, that this is Archimedes on the screen, and he was in a bathtub, and then suddenly he said, he got an idea, said eureka, eureka. And secondly, you see on the screen Alexander Fleming. He was coming back from a vacation. He saw a penicillium mold growing on a culture, and he discovered penicillin. And it seems as if innovation happens on like a sudden eureka moment, but actually it is not true. And this is what I want you to know. Don't be shy of, you know, working in the zone where you want to become an entrepreneur. Don't be shy of working for somebody. Like, I saw this question, a lot of people had asked that I am doing my MD radiology and I want to open my own radiology center. So when should I start? I would say that what is the harm in spending 3-4 years in a well-run private center and learn the art of running it without actually investing your money and your risk onto it, and learn it and then implement it. Now what happens is, I'll give you an idea, I'll give you a background. Now what happens is, whenever you're deeply engaged onto something, you start seeing gaps in the delivery of the service and delivery of the what we are trying to give to the consumer. There is always a gap that we like. I'll try to explain it. Like, it seems that everything has been invented, everything is already there, but it is not true. I quoted this on one of my blog posts also, that about a famous physicist who was Max Planck. He was about like, he wanted to join physics as a career, and his mentor told him that, "Arey, physics mein everything is already known. What do you want to discover?" And he discovered entire new branch of physics called as quantum physics. So there is always things to be innovated. The same thing that is being done by other people can be done better, can be improved upon. There could be a new thing, there could be a new method of business that people have not thought of. So innovation would happen when you go deep into it. It would not happen when you are like, now let's imagine now, like it would not happen that, you know, you're sleeping in your bed and one day you wake up, okay, oh, this is how I should run my radiology. It's not. When you start doing it, when you go deep into it, every time you will see lacunae, you will have to sculpt it, you will have to improve upon, and you will reach to a level where it could be called as an innovative product. I'll give you tiny examples. Like in our app eMedicoz, we have a section called as ebooks, where we give study material in form of ebooks to our students. And what I realized in the last 3 years was that the students who are coming to us are at an age, and these millennials are not actually reading any book. So you give them a book in ebook, you give them a book in the print form, they are not reading anything. Although they are collecting everything, but they're not reading it. So an idea struck us that why can't we make a podcast on each chapter? So in our app now, on each chapter that we are giving to our students, there's a podcast. And so what happens is when you go deep into it, you realize what is the lacuna. Similarly, recently we started resident teaching. We started resident teaching in some specialties already in AIIMS. And we saw the lacuna was that everybody was talking about the interesting cases, interesting surgery. Nobody was taking the basic, teaching out of that is required in when you're doing a post-graduation. We saw a lacuna, we tried to fix it, and we're still trying to fix it. Innovation happens when you are deep into it, deeply engaged, you realize there is a gap and you try to fill it up, and then gradually you reach to a level when you can call it innovation. Okay. When that jugaad becomes an innovation is like, this is like, it goes step by step. It doesn't happen all of a sudden. It is all, overrated that one day you will have a eureka moment. It doesn't happen like this. Even Alexander Fleming was already working on molds and penicillium for many years. And that is why that accident happened to him. Serendipity accidents, they don't happen to untrained mind. So you need to, get into deep. Now, one of the questions that somebody had asked me in the Google form that we circulated was that, sir, how do I decide how do I, bargain with the machine vendors? How do I buy this? So again, my answer is that when you are like at a stage where you are, let's try to understand, when you are like working for somebody else, you're working in a hospital and the hospital is planning to buy an MRI machine. That is the time where you need to, get into it and say, even if your boss doesn't want to involve you, you can raise your hand and say, I want to, contribute to this. I want to, be in the meetings with the machine people. I want to understand what functions they are giving, what they are, and I will also contribute by my research. And the, hospital would always have you on board because you are trying to contribute. You will say, I will also find out what Philips is offering, what Siemens is offering. And you get a free of cost training on how to, buy a machine, what features to look at. And I think there is always a room, there's always a value in, working and learning. Now, when I say working and learning, what does this mean? Now, what it means is, in the healthcare or in any, today we have seen in the last 2 decades with internet and mobile phones, the world has changed so fast that the world that we knew about in 1990s is no longer existent. It is totally changed. So in this entire journey, you will have to, learn something, then you'll have to forget about what you've learned, and then you have to relearn something new. For example, I'll share from my own experiences that, at DAMS, we were initially very, very, strong and bullish on Facebook and Facebook related, discussions with students and everything. And then we realized that, young students are not right out of school, getting into medical college. They're more on Instagram rather than on Facebook. And like you learn, you unlearn, and then you learn the new way of making, what is Insta story, how does it work, and so on and so forth. And then, now I've learned that how, we can work on Twitter Spaces, what is a Clubhouse. So it would world would keep changing. And even in healthcare. Now, we all have seen the era 1990s. We started with a 0.3 Tesla MR, and everybody was so excited about it. Then we came to 1.5 Tesla MR, 3 Tesla. So things would keep evolving, and you have to keep learning. So when I say learning, what does it mean? To me, learning means is, I'll just, very quickly, give you an idea. As a child, we are all excited to learn. Like if you were in class 5th, if you remember from your class 5th, you were in class 5th and your teacher told you about a new planet or a new continent or Antarctica or, a culture in Alaska. You were always excited to learn about new things. But when we grow up, especially when you become a resident doctor or you become a senior resident or a fellow, what happens is you start feeling that now I have done the learning part. Now I should be earning money. I should not be learning any longer. I know everything. And what happens is this kind of mindset, like this is where we grow old. The day we stop learning, we grow old. And this my entire submission today is that to become an entrepreneur, you will have to constantly learn. You will have to learn the ways of the new world. You will have to understand, okay, the earlier my patients were coming to my diagnostic center because of X kind of marketing, but now they are coming because of Y kind of. So earlier it was like a newspaper thing. Now social media is driving more business to me. And you need to understand that how you can be relevant in a new world which is changing every day. And what you know today is already yesterday. So we need to move faster than the, than others to, actually create value for our own self. Now let's go more deeper into it. If you really feel strongly about any idea, you feel very, very strong that, okay, this is what I want to do. It's always good to pen down your thoughts into a single page of simple common sense language that, okay, what is it that I want to do? Who would be with me? I saw this question on by one of the people on in the Google form that we circulated was, how do I select a partner? So my experience of selecting a partner here is that most people, what they do is when they are thinking about, making a partner, they are only thinking about how the profit will be split. You understand? So what happens is they think, if I make somebody my partner, I will make 50%, he will make. So everybody's thinking about profit. They are not thinking about the roles that are to be played. And that is where the problem starts. So I think if you are, looking at partner, you should always find out somebody who is complementary to you in his skill set. Like suppose if you're academically good, somebody else is good in marketing. If you're good in tech, somebody else is good in medicine. So you are good in medicine, somebody else is good in technology, and you are able to make a team where both of you are complementing each other. Both of you are synergizing to create value, which is much bigger than 1 + 1. So 1 + 1 should not become 2, should become 11, because you are synergizing. But that is only possible when you decide on the roles first. So you decide, the business plan includes that, do you need a co-founder? Will you be the founder and you will hire other talent? Or the business plan also includes that, what is the, market size that you're looking at? And how do you plan to disrupt? What are the other players in the market? Is it an already saturated market, or is it something new that you're trying to do? What is the kind of money that you would invest? How would you get that money? And then how would you market your product, and when would you break even? And these are the kind of things that you need to write down in common language, even before you talk to any MBA and CA. And I see people talking to chartered accountant and lawyers about businesses. I have never been able to, get in line with either of them. Like if I take advice from my lawyer, he would not allow me to do any business. If I take advice from a chartered accountant, I would rather not do anything in life. So it's like, it's up, you have to find out what you want to do, what is your common sense idea, then go to experts for particular parts. So you can go to your chartered accountant for taxation related things, you can go to your lawyer for the legal aspect of it, but the business idea has to be yours. You have to find out that how you want to do it and try to put it in simple language. Now, if you compare my talk that I'm doing today to technical talk which is done in a B school, or which is done in a technical college, you will find that, okay, I'm talking common language, because I believe that if you cannot write a business plan of yours in common language in one page, or what we people in business would commonly say as an elevator pitch, like you meet an investor in an elevator and you pitch it, and by the time the lift opens, you should be able to explain to him what you want to do. But even before explaining to others, if you are able to explain it to yourself, that is very important. Common sense business plan in one page. Like you can, start off by, thinking about, this is how I'll go about things. I'll give you more, getting into more deep questions. Some people have asked that, sir, I'm already 30-year-old. Do you think it is too late to become an entrepreneur? So my answer is, doing business or doing anything in life has nothing to do with your chronological age. Chronological age is age calculated from your date of birth. It is everything to do with your mental age. And I'll again take you back to the thought process that I created. I talked about that you start off by believing in being a learner. In this journey, I'm sharing with you that I think 11 years back, I went to a small town near Delhi, and I saw that with some colleague of mine, and we envisioned the idea that, okay, this is the small city where around 80 kilometers radius there is no diagnostic center, and we decided that we'll put our own money. It was around 15 years back maybe, that we'll put our own money and we will open a diagnostic center. And we started the diagnostic center. To realize later on, we realized that both of us were from Delhi, and the center was 80 kilometers away, and we had no time to go there, and I was busy with so many of other ideas. And that idea of ours, which was theoretically correct, and there was no competition, we were the only ones, but we had no time to actually look after it, and in the end we had to close that game. So everybody makes mistakes, but the idea is that I don't take it as a mistake, I take it as a learning experience. And that is what I mean by mental age. If you look at your mistakes as learning experience, if you look at your failures as learning experience, you will always, be young in your mind, and you will always be able to do it. It has nothing to do with the chronological age. I always quote an example of KFC founder. The person who founded KFC was, when he started franchising, he was at the age of 65. So you're still young. I also quote an example of a lady that I read about on LinkedIn. This is a lady who is a 90-year-old, and she's making some designer potteries, and she's selling on Amazon and on Instagram, and she started her business at that age. So it's not about your age. Don't get that notion. Like what is happening to doctors nowadays is because they keep talking to IIT students or some engineers, and these engineers from first year of their college are totally talking about startup, and you start thinking that I am too old to do it. It is not like this. There is always some time to be spent learning the art, learning the core competence of any field, and medical science happens to take a bit longer, and that is normal. It takes longer. You can't learn medical science in one day. It takes longer time. That is okay. But it is like you're spending your time to gain expertise into what you would do later on. And progress is always more important than perfection. I'll give you my experience into it. Every time I do a seminar or talk on entrepreneurship, some of my friends or colleagues would come to me and say, Sumer, I want to open a hospital like Apollo Hospital, or I want to do a Tata Memorial. I want to do a big hospital. I want to open a diagnostic chain like big names, and I want to do this and that. And I always tell them, let's start small. And starting small has its own advantages. You can start fast. And this is my answer to the question that many people asked, that, sir, in today's world, setting up a diagnostic center has so much cost. Should I start it? Now, why do you want to put all your money in day one by taking a loan? My suggestion is, my idea is always is to test the waters. Like suppose in a area X, you want to open your own diagnostic center. It is always a good idea to work in a hospital, a leading hospital in that area for some time, to create the network, to learn the art of that area, to learn the dynamics of that area, to learn about the referring physicians. You get a hang of it. There's no need to rush to take bank loan and sell your father's property and everything like that. Just wait, learn the art of it. Then you should always go small, and Maybe you can take a rented property. Don't lock all your money into the property that you buy. You can rent a property and then go small. You can always start with an ultrasound and maybe an X-ray. Start testing the waters. Maybe, you know, maybe the location was not perfect and you want to change your location. But if you put your MRI machine, you can't change your location later on. So it's always good to start and build up. Like I always show this example that I'm showing. This is your famous Taj Mahal hotel from in Mumbai. What you see is now if suppose today I want to get into hotel business and I imagine that, okay, one day I will start my business when I will be able to create a building as good as this, then I will start. Maybe in my lifetime, I will not be able to start. So you have to start fast and then learn on the way. And what happens is if we keep waiting for a perfect day, it may not happen. Like the example that I want to tell here is there is a colleague of mine who keeps saying that, Sumer, I want to open a big hospital. And every time he sees me, he gets excited. He says, how can I raise money? Who can invest on my project? I want to make a big hospital. And every 5 years, he repeats the same thing to me and he is not doing anything about it. And every time I tell him the same thing. Let us start with a small clinic, then we'll add some more beds, and then we'll add some more beds. And gradually you might become Apollos and Tatas and all those things, but let's start small somewhere. Starting is very, very important. Most people, they get stuck at the inertia of starting. And so that is why everything is interlinked. That idea is not the big thing. It is about, you know, execution. The person who's implementing it, growing it is more important. Idea, everybody has an idea. What is so big deal about, you know, opening a hospital? Everybody knows that there's a need of an hospital, but you need to do it in your own way. So starting is more important than thinking. Okay. The second is progress is more important than perfection, because what happens is sometimes your desire to be perfect becomes like an obsession and it stops your progress. And I'm forgetting the correct word that we say, paralysis by over analysis. Some people, they keep analyzing the situation whole life and they become the critics. They keep only commenting on the cricket match. They never get to play in their prime of their age. So it is important is to start somewhere. Starting is very, very important, and starting small, starting safe is very important. Don't take loans in the initial part. Don't look for, you know, equity dilution in the initial part, because I see a lot of youngsters coming to me with an idea and say that you put in money and take equity. I always say that if the need is not so big, if you can fund your own idea in the initial part, you will be able to raise capital later on by less dilution. If you start, like suppose if you want to open a diagnostic center and you meet somebody in your a relative or a friend who says, okay, I put money, you work. You could have done it your own self by going a little bit slower, and rather than having a partner who is not bringing anything to table other than capital. So we need to understand what people are bringing to table, and you know, how do you see yourself in long run in this picture. And there would be barriers that you will have to break. The first barrier would be fear. Anytime you want to do something out of the routine league would be that, okay, I join a medical college, I become a registrar, I become an assistant professor, I become a student. So I want to go outside the line that is everybody is following. I will have fear because I am the only one who is going on the other side. So you have to break that barrier of fear. And then there will be, when you start working, you will realize that initially you thought that running your own business is fun and you thought that it would be easy. Other people will be working and you will be sitting in an island enjoying private aeroplanes and everything. Nothing of that sort would happen. You would be actually working twice hard, because when you are an owner, there is no 9 to 4 job. It becomes your own game. When you are an entrepreneur, you work a day. So then you start feeling the pain also. So the ability to continue forward despite the pain of hard work and despite the barrier of fear is what I call as grit. So these are the things that will help you to continue. So idea will help you to start. A progress mindset that, okay, I want to start, I want to get it going, would help you to start fast, and to take the leap of faith with minimum information. You're able to do it. And then you need to persist despite failures, despite pain. You need to persist. And before I start taking questions, I just to give you an overview, it is all about passion. What is it that you are truly passionate about? And later on, down the line in your journey, you'll start thinking, what is it that you bring as a purpose? What is the meaning of your own life? what is your purpose, and when your business is, what you are doing is reflective of your passion and purpose, it grows much bigger than anything else. So on this note, I'll invite everybody who wants to ask us a question. I'll ask Akshay or Varun to pitch in. I wanted to give you an overview, but the key is in starting. The key is in, finding that one idea that you are okay with making it your life, not, millions of ideas. Many people sitting in the drawing room would say, I have millions of ideas. There is no value to those ideas. That is what I feel.
That was quite fantastic, Sumer. I mean, it was a pleasure listening to you. And some of the terms that you use, no, I mean, I must use them somewhere, that analysis and paralysis, especially. Very, very cool terms. But before starting, I mean, I think I'm not the only one who really wants to hear your story in a little more detail. Because from what I heard, I don't know if this is rumor or this is fact, but you actually started DAMS during your residency, or just the idea was there during your residency. But in short, can you just tell the story of DAMS and how you took this leap of faith?
Yes. So what my idea here is that, it all seems as if I'll give you the answer back in the same story that I was telling about a colleague who keeps asking me that I want to open a hospital, but he never does actually. So, and whenever I tell him that, okay, start small, start with 1 or 2, beds, and start small and gradually grow it, he always comes back and says, Sumer, you are doing 250 centers across the country. You are doing such a big thing. Why do you want me to do small things? Then I have to tell that I started very small. I started very small, and I started with no idea of what I want to do. We started with a few students. We were teaching in Delhi because we were excited about teaching. We were excited about, what can be done in this space, but we never had, we could not see the today of what we are. So that is where the leap of faith becomes more important, that you always have a blurred picture that this is something which is feeling good to me. I like doing this, irrespective of the pain that I'm going through of working harder, or, people after 9 to 6 job are going home, and I'm at 6 o'clock, I'm going in to take a lecture, or I'm going on a Sunday morning to take a lecture. So you're undergoing that pain, but if you're enjoying it, gradually you learn the art of business. So because I am from a non-business family, I had no idea what the terms that we use today. I had no idea about those terms. So I learned gradually that, okay, how to make a franchise partner in your brand, what is a partner, what is private limited. And I quickly learned a lot of things, but in the first 2-3 years, it was only like a hobby that, we're doing something and we are enjoying it. It was never about money, and it is still not about money. It's more about passion.
But because you speak of this, how important is it to understand the economics of what you're getting into in detail when you are actually starting?
Now, there are 2 schools of thought to it. And I think if you talk to, every time I've done something, and when I ask the accountants to make a plan out of it, they tend to be overtly pessimistic about the outcome. Like suppose if you decide today to open a diagnostic center in Mumbai, and you ask people, everybody will be pessimistic, like, right, there are so many there and you will not be able to earn, there is so much cut, and all those people will give you hundreds of excuses. But when you really want to do it as an entrepreneur, you have to have that optimistic. So people who are entrepreneurs have an optimistic bias. So sometimes we make big failures also, but we have an optimistic bias. So I believe that if I firmly believe in an idea, and on gross picture itself, on the blurred picture itself, I take the leap of faith. I don't go into over analysis of the economics, which is contrary to what some other people would do, but it's my thing. But if you're taking a loan, I would still say, if you're taking a big loan or a big burden on yourself, which is much higher than what your monthly income is, then I think this analysis is important.
Okay, so I think we can go through. You have answered most of the questions actually, but perhaps Varun, you want to start with some of the questions which are still there on the Google Forms.
So basically, I wanted to ask is, someone like you who's an entrepreneur, author, blogger, TEDx speaker, how do you manage your time throughout the day? And if someone is aspiring to have a career like you or something of that sort, how do you manage your time throughout the day?
So it has been, my time management has been in my initial years, it was very messy. When I talk about my initial years, when I was working as a radiologist 9 to 5, and then 5 o'clock I would go to DAM's office, work out the strategies, work till 11, 12, go home. It was all messy. But gradually what has happened is I have learned to prioritize. Now what I've learned is that there are like the way to time management is to have priorities, and my priorities are like very clear right now is family, uh, dreams, passion, and your own health. So I think these three things, like what you really want to do in life, your own health, and your family and relationships that you create. And for the younger people, that family would include the family that you want to make in future as well. So you have to give time to all of them, because there's no fun if your girlfriend leaves you and you are building up a business. I think you need to have that balance in these three zones. I think these are the three zones: relationships, dreams, health. You can't compromise on either of them. If you prioritize it right, then time management starts happening. And then another thing that we need to do is we need to know that there are things which will take time. Like building a business would take time, learning the art of radiology will take time, becoming a great famous doctor will take time. You can't accelerate some things. So be patient, and you will have to invest time as a professional. I totally like, I'll give one more quote for Akshay here. Is very interesting line that I keep saying is that some people say that, Sumer, you work from 9 to 11 and you talk about working for 12 hours, 13 hours. I am a smart worker. I can do the same in 2 hours. Then I keep telling them, okay, I'm smart also, I'm working hard also, then come beat me. So you understand that somebody is smart and he's working hard also, it becomes a very difficult proposition to beat. So it is like there will be like, I'll give you another line that I keep that somehow helps us to understand that sometimes when we meet people at a certain age and at certain level where they have reached, like you meet Amitabh Bachchan today and he comes back and says we all should have good work-life balance, spend time with family. But we have to understand that he is talking after he has achieved everything in life, and now he's looking back and being wise. But when you are creating your own business, there will be times where time management will go for a toss. You have to handle it if you really want.
So initially there'll be some sacrifice on that work-life balance.
You will never,
when you're starting,
like sacrifice if you're enjoying what you're doing is that is very important. If you are not enjoying, then it'll feel.
Yeah.
But that takes us to another question which many have asked, and that is, it's easier for a guy to manage the time and invest more time in work. But when it comes to a female radiologist, it might not always be easy to balance family and work. Any thoughts on that?
Definitely, that has been the traditional mindset. But if we look at the number of female lady founders in businesses today, in startups today, I think that statistics is what I've learned, and I want to say it in public, that what I've learned, and I've learned a lot from my wife, that women are much better at time management at times. So women, despite having multiple responsibility, they have been, they know that they have to take care of their child. They know there are things that they need to do, and there is a business or a passion or a dream that they want to follow. So once they get into it, after the initial hitch about ये लोग कह रहे हैं कि नहीं कर पाएगी और ये वो, जब वो सब हट जाता है, and when you get into it, when you do it, women are able to manage time better. And I see this in the female employees in our company also. The ladies who are working in DAMS, they are able to finish things in time, and they go home at 6 o'clock and finish off. The boys till 6 o'clock, they are only talking. And then after 6 o'clock, they start working overtime. So it's like, it's very important to understand that ladies have an innate sense of timing. They know how to balance it. The only thing is they have to get out of this, pressure that the people around them. Sometimes what happens is not only people, sometimes you may have people in your own family or in your own vicinity who might be negative about a woman becoming an entrepreneur, and they weigh down on your mind all the time that ladki hai to nahi kar payegi. Aisa kuch bhi nahi. It is about giving, like business is also one of the, one of your child, and you have to give your business also time. You have to give your family also time. It is like you are able to do it, and ladies are able to do it better. But once they get into it, Till the time, you know, there would be question marks because people will keep saying ye nahi kar pai. It is just like you keep hearing that you know, girls who are not good driver, men are better driver, and my wife drives better than I do. So it is on record now.
Okay. Okay, so many people, freshers who are in their final year of MD, or they are doing their senior residency, they've just passed their MD exams, and they see people who are preparing for DM, some are preparing for FRCR, some are preparing for USMLE, some wants to start a center, join a center, somebody wants to stay in hospital, publish papers. So a person who has not decided any of these things, what he wants to do in life. So what is your advice to such people?
Go with the flow. So once you do not know that what you really want from life, take the first opportunity that is coming your way in chronological order. Now, this is what my learning has been, that suppose I don't know like what I want to do, and I apply in 5 hospitals, and first one calls me, I go and join it because I don't know what to do. So let's believe that there is a system in the universe which is pointing me to the right direction. Chronologically take the leap of faith and start moving. But I'll, you know, complete a line that I was about to say. A lot of people, a lot of women, sometimes they come to me and say that I am not pursuing this business idea or this career option because I feel that my family would not be happy if I'm not giving time to you. And my answer to this is that time that you give to your family can be divided into quality time, quantity time. And suppose if as a lady of the house, if you're not happy because you are not pursuing your dreams and you are compromising, if you're not happy, you will not bring, even if you are bringing quantity into the household, you're not bringing that quality, and your family would understand once you're happy. So you know, if you're happy, you would give that kind of you know, vibes to your family that would make it pretty good. And I think another thing that we were answering from maybe we can take that question up again. I forgot the thread.
Okay, so you know, the 2 most common questions which we have seen on the survey, one was on AI, you know, the fear of AI, medtech. So A, either you are worried about it, or B, can I go into AI rather than practice your routine radiology? And the other one was about cut practice. So, you know, if you're starting a center, but you want to do it ethically, how easy is it? Is there a path to do it? Any suggestions on that?
Now, this is like getting into a very, very deep, entrenched rot in the diagnostic industry in India, especially in the northern segments and all. But I would always suggest to start, you know, before you get into any of these practices, it is always important to start where your moral compass is. Like explain it to you in a line that, like, suppose this is what I don't find right. Suppose there is something that you don't find right. There is no need to compromise on that right just because just to accelerate your business. It's better to go slow, maintaining your moral compass. So there's no absolute rights and wrong in the world, and I'm not, you know, I'm not in a position or at an age or maybe at an experience where I can judge rights and wrongs in the world. But what I understand is there has to be a moral compass that you have. Like, for example, I'll give you an idea that when we started DAMS, there were some private colleges who would come to us and say, if you can, you know, refer students to us who will join PG in our college. He said, we will not do this. And like, this is not what my moral compass says, and I'll not do this. And like a lot of people, they keep coming to us that, you know, you have so many doctors on board. Can we sell this product to them or not? If I'm not convinced, I don't do this. I don't do, if it is not in my moral compass, like there are degrees that people are offering, which I feel that these are not genuine. So they come to us and they say, you know, can we promote this kind of degree for doctors in your channel? I said, you know, I don't find it right. So morally, it is outside my moral compass. It is okay. I don't want to do it. So you need to draw that line. Once you draw that line, go slow, things will happen as per, you know, people will adapt. Once they know that, okay, ye aadmi isi tarah kaam karta hai, they adapt to you, and then you, but if you keep going down and going down, and you are not liking it, what you're doing, you're not happy about yourself. At the end of the day, doing business, becoming a doctor, becoming a radiologist, at the end of the day, it was about your happiness. So if you're unhappy about doing something, don't do this. This is what my take is. To make, remember, there should be a bottom line of moral compass for you, and you should understand, am I compromising on it? And this is what I feel is true for even for things like partnerships, things like relationships. You have a line drawn that, okay, till this, because you need to compromise a lot if you are in a partnership kind of a business. If you are in a relationship, you have to bring some healthy compromise to the table. But beyond that line, when you start compromising self, that is where things starts suffering, because inwardly you start suffering. So in cut practice, if it is not, if it is beyond your moral compass, you feel this is not right, don't do this. Wait, have patience, things will come to you. This is what I feel. And that is where it was important not to take too much loan at the outset. I see a lot of youngsters who would say that I am taking, sir, 5 crores loan and 6 crore loan. And then you put yourself under so much pressure at the first go that you start thinking about that, how to, because there is an EMI coming up. EMI is coming up, and then, should I pay, cut or not, and all those things happen. So that's why I want you to build reputation step by step.
That's a beautiful explanation, Sumer. I mean, just fantastic. And just sorry to interrupt you, but Tata had an entire discussion on starting an ethical practice in which Dr. Bhavin Jankaria, Dr. Sanjay Nagral, and Dr. Anirudh Malpani were, spoke, and it's there on the TMH YouTube channel. So if someone is interested, do go and have a look. There were some really interesting ideas which Dr. Malpani especially had put up. So I think that'll be interesting for those who want to do something like this. Yeah, but the other one, then AI.
AI. Now, when you look at things as a radiologist, and when you think that, like, imagine now today, if you think you're working in a hospital, and if you have a feeling that you are replaceable. So there are three kind of replacements for you. Another radiologist can replace you at a cheaper cost. A teleradiology service can replace you, or you feel that in future an algorithm can replace you. Now, but if you ever feel that you are replaceable, that means you're not bringing enough value into the system. I'll explain it in a slightly longer, with a longer answer. If when I was working as a consultant in a hospital full time, that was a neuro hospital, specialized neuro hospital in Delhi. I was working there. So when I was working there, I was not only reporting CT and MRs, I was also bringing value in terms of communication with the clinicians, communication with the patients. And what was happening was, if a neurologist had a CT done of his patient in the morning, he would call me up. I was telling him what is it that I see, and I was also telling about what else we need to do now, radiologically speaking. Do I need an MRI? And I was always bringing value into the system. And many a times when a certain kind of patient is there which is rare, and I want to do some extra sequences, I would always download an article about that and send it to the neurologist in his OPD. He is busy, or a neurosurgeon is busy. He looks at it and says, "Acha, that is why you want to do this," and he would be happy. And I was bringing more value into it. Now what happens is, now if you are bringing the value into the business, where you are communicating, you are also talking to the technician, telling him that, okay, this is how we should be improving our sequences, this is how we should be improving everything. When you're doing it, you are not replaceable by any algorithm, any other person, and then you feel more secure and you bring more value into the system. Insecurity is a problem that would always affect you. You will keep thinking about, bhai AI to abhi aaya na, abhi to koi sasta ladka aake replace nahi kar sakta tha. Suppose you are getting a 2 lakh salary, somebody who comes and says, I am taking 1 lakh and I'll work twice, he works, and you are replaceable. But when you bring value, you are not replaceable. And getting into more deeper into AI, when you look at AI as a, now what makes radiologist, what made radiology the sought after branch? Have you ever wondered? The radiology was made sought after when computers and radiology got married. Before the advent of CT scan, what was radiology? Nothing. Nobody wanted to do radiology at the X-ray era. And when the computers came into place, we could see more than what the clinicians could see with their hand and their stethoscope. We could see more. and we became more important in the hospital. With AI algorithms, we will be able to see more than what meets the eye. There will be more data in the images that we are not able to see, and there will be people who would become the leading edge of it. So don't look at AI as a foe or somebody or algorithm which will replace you. You will be the data scientist there, which is what my feeling is. It is like, it's like people tend to overestimate what technology can do in the short term. So what happens is we start thinking that अरे अभी AI दो साल के बाद radiology खत्म, कोई नौकरी नहीं है, ऐसा कुछ भी नहीं होगा. But we underestimate which will happen in the long term. In the long run, you will be bringing much more information in patient management, because you will have at your hand so many tools that people never had, in addition to your eyes and your brain. So I think the value will be much more. So don't look at it as a replacement. It will never happen.
Got it. Yeah, and just again, so I wanted to get Varun in the picture here, because both the things you spoke of adding value, of creating value, and of innovating in your practice. And I've seen Varun do some wonderful things in his reporting, the style in which he reports. And I was hoping, Varun, if we could share a few of your reports, just 2 minutes of time, Sumer, because some of the things he's done is quite amazing, So I'm going to share the screen, Varun. And if you can just talk us through what made you start. And this is simple stuff, right? I mean, this is stuff which it's not difficult to do. But look, these are all Varun's reports. I hope the screen can be seen. Is everyone able to see the screen?
Yes.
Yeah. So Varun, do you want to talk us through what made you, so like this is his MRCP report. This is how he gives it. So this is all, what the doctor gets. And I mean, which AI algorithm can give stuff like this? And just like Sumer talked of podcasts. Yeah, so this is the fistulogram report. I think this still people do. But I mean, that MRCP report, and I mean, I've seen a couple of his, like the podcast that you spoke about, Sumer. He's actually created podcasts of reports. So he's shown the image, shown the fracture beautifully on video, and shared that with the referring physician. And it's not difficult to create value if you do things like these, right?
Yeah, sometimes when you're not able to describe a complicated fracture or complicated lesion with your words, you can always add pictures to your reports. I think it is quite simple now. Most of us are using Mac and taking screenshots, putting it into your reports. That is all quite very easy, and it can be done now. So I've seen many leading radiologists do it. So I thought, why not even I do it? And it was quite simple. And sometimes when I can't describe a lesion or a complicated fracture, I generally tend to do this, put a picture in the report. I think this is more understandable to the clinician as well. And this is something which can be done, and it just take hardly 5 minutes of extra time, and you'll be able to do it. And as you keep on doing it, you tend to become more fast in how you'll be able to put this into your reports. So yeah.
So what I'll add here is that, I'm very happy to see what Dr. Varun is doing here. And it is like a lot of people keep asking that, if you are not talking to the doctor, what is talking to you on your behalf as a radiologist? It is your report. And what you see that Dr. Varun has created is a piece of art. So your radiology report is your personality written on the paper, which is going to the clinician. So please take it seriously. I keep seeing, residents who are writing pathetic handwriting, pathetic lines. So, you see what he's doing is he's creating art on it. He's creating messages on it. And it takes me back when I started my teleradiology services in 2007. We started giving key images at that time in our report, where we took the image snapshot and put an arrow on the finding, and it was much appreciated by the referring physician, because for him to go through the stack of images and find where is the key image, because once you show the key image, everybody is able to see the finding. But to find the key image, you need a radiologist. So we just give a key image and put an arrow and give it. That is a good thing. And second thing I appreciate is that what he is doing is he is also looking at beyond the paper report. And that is one of my feelings. And I already told you that I'm very open with my ideas. I share them. I think if somebody feels, and Varun, you can also do it, that on report, if you can think of a way to give a small video or like or audio on a phone, like you said, to the physician, that give him by name, Dr. Malhotra, I saw a case referred by you, and I feel that it is, and send it on a, instead of calling up. Now this becomes asynchronous. Asynchronous means that, when we are calling up the surgeon, he might be busy and we are not able to catch him up. And when he calls up, we are in family time and we don't want to. So you can do asynchronous, and this is possible that in future somebody might look at it as a platform also to give audio notes on your comments for the patient as well as for the
yeah.
It's beautiful actually.
Yeah.
You want to ask the next question, Varun?
So many people had asked about creating a passive income through social media, YouTubing, and so can you share some ideas on that?
But there is no income like passive income. Okay, and there is no free lunch anywhere in the world. It is like, I'm totally understand where you're coming from and all those things, but every time I don't know, maybe I don't know what to do, but every time I have tried to do it, I've always burned money because I don't have time to understand it, and I do errors. Like sometimes people will come to you and they will say, Dr. Saab, look at this piece of land. This is where a shopping mall is coming up, and this is where you will have Haldirams. This is where you will have a movie theater. All you need to do is put some money and you will start getting rent, and you put in money on ground, on dirt where nothing is there, and sometimes nothing might happen later on. So it is good to look for income other than what you're doing. It is good, I understand that, but don't be blinded by the cocaine effect. This cocaine effect means, now what is this cocaine effect? This is a business term. I want you to understand, this is not a drug term, not a narcos term. Cocaine effect means that you go to a place where there is nothing, and somebody builds a story onto you that, okay, this is where there will be a cinema, this is where it will be an airport, and the airport has not been sanctioned by the government, but there will be an airport. This is the shop that I am giving you, and this is where you will make rental income of 5 lakhs per month. And you're like, wow, 5 lakhs. Now you're only thinking about 5 lakh. It is like cocaine on your mind. You're not thinking that abhi yahan pe kuch bhi nahi hai. You put your hard-earned money that you earned in 5 years by working 9 to 6 in the hospital, you put it in. So it is like even when you seek passive money, you need active involvement. Even when you put money into investments, if you put money into properties, you want to have rental incomes, you still need to actively involve into the location. You need to find out, is it authorized? Am I putting my money into something wrong? You will end up burning a lot of money. It's like, you will try and imagine, suppose I am a radiologist full-time, I'm working in radiology full-time, and somebody else tries to report an X-ray. He cannot do better than you because he is doing it for 2 days, you're doing it for 10 years. Similarly, somebody is investing into a certain kind of business for a long time, they are more likely to do it better. So it is also important to take help of professionals at that stage, or seek help from people who have done in that domain. It could be a passive income for some of us, but it could be livelihood for others who are investing into things like rental incomes or things like shares. If they are doing it full time, maybe you can take a wealth manager and give him money to manage your wealth when you reach to that stage.
So, wealth management, I think we had a webinar on wealth management actually, and I think many of the attendees must have attended that. So that's of course important. But if you want to start a center and you want to find investors, A, someone who's not a doctor, B, someone who's a radiologist, B, taking a huge loan, how do you balance that decision?
So when we talk about taking an investor for a diagnostic center, what do you think is the most important pain point in a diagnostic center? The most important pain point would be that, if you are a radiologist, radiology is not your concern. Your concern is how and why the patients will come to you. So if you are seeking a partner who is investing and bringing value, he should be the one who is bringing the patient load. And I have seen some successful practices in Delhi. I don't know about Mumbai, but where leading clinical practitioner would partner with you, and also ensure the patient load for you. That is like a synergy. Like suppose I am a radiologist, you are a radiologist, we open a diagnostic center together. Then the only synergy happens is that, okay, one day, Monday you work, Tuesday I work, and like this. But the skill set that we are bringing, the expertise that we are bringing is same. While if somebody from a marketing side who has a marketing acumen comes in, he brings a different skill set to it. Don't just look at the money. Again, I'm saying when you are joining hands with a partner, it should not be somebody who is just contributing money, because money later on you might earn your own self, and then you will not like that you are sharing, that he's not doing anything and everything is for your side. It's like, don't partner only for money is what I feel. He should bring value into the domains. Like if you are good at radiology or medical side, is he bringing the admin, is he bringing the marketing, what is he bringing to the table is what I would feel. And I just to add a line here, which many people don't understand, is why do you want to become an entrepreneur? Is because you want to do things your way. You want to do things, you feel that what people you are working for are not doing it creatively enough, and if you were given full freedom, you would do it your way. Now imagine now, and this is a question that one of my friends also, he said, Sumer, somebody is ready to put 100% money for my hospital and I will become an entrepreneur. I told him that, and he is a grown-up adult. I said, if he puts in 100% of the money, he owns 100% of it. You are working for him just like before. You don't become an entrepreneur. So when you seek freedom, don't get confused. If somebody else has put 100% of the money, then he owns 100% of it. Again, you would have the same, stringent environment that you had when you were working for somebody else. Like when you're working for somebody else, not all your ideas will be implemented, because the person who is owning the system would filter them according to his own vision. And that is why you want to become an entrepreneur. So keep these things in mind, that how much equity are you diluting at the beginning, and is it only money, or is it money plus some value?
So basically it is okay to start small, start with the USG center, and then generally build up with how it goes, how your practice goes about. Yeah.
Varun, I want to ask you also, like, what is your idea on it? Like my idea has always been traditional: start small, keep the 100% equity with you, grow it, build it, and then at a certain level you'll need funds, and then you can
yeah.
But not at just at the idea level, and you are already at 10%, somebody else is owning 90% of it. You are just an incentive.
Have a target. I would say have a target, like when you want to do it. Say at the age of 40 you want to do it. Save till then. Save as much as you can. Invest it. Keep your corpus ready for that time. How much ever, decrease that loan part. How much ever you can.
And one interesting thing, that comes to my mind when I'm listening to you is, like, it is like, there are so many cars available in the market. There is Mercedes, there is Audi, there is so many cars. But if you want to start your taxi service, do you want to buy the best available car in the market, or you are happy with the one that is more cost effective? So there is a good case right now for refurbished machines as well. Now, in 1990s, we saw the machines were evolving like anything. You buy one MRI machine and they were bringing another machine, and they were like, but in the last 5-6 years, I have seen the innovation is now happening more in the software side, in the algorithms, in the data, not in the hardware. So, you get a refurbished machine at a low cost, rather than having a partner, you own everything and then you grow the business. That is also one of the possibilities. People may or may not agree. But if I'm starting a taxi service, I would not want to start it with a fleet of 7 series. I would be more cost effective.
Unless, of course, it's COVID time, and then you would certainly want the city.
City is a very important thing.
A few people have asked this. So, some people want to retain the clinical touch. Is it possible for a radiologist to also have a clinical practice where they see patients along with imaging, doing the imaging? And then many are asking, suppose they are highly specialized, but say a cardiac radiologist in a tier 2 city where they don't have enough, there's not enough demand for such a subspecialized branch. Any advice for such sort of subspecialized options? And how do such people target the referring physicians? Any tips and tricks on how to, network with the referring physicians when you're starting new in a tier 2, tier 1, or tier 3, whatever city?
My answer here is, if in your city there is no work for the specialty that you have spent time in gaining expertise, change the city. You can, it's like there is no, you're not a tree, you're not bound to the city. Like you can move and go into a place, into a space where you like. Let's go back again to your why. Why did you get into cardiac radiology in the first place? What was your why? Because you were excited about it. Are you still excited about this specialty? Yes. If you are, and if you feel that this is what I want to pursue, then can you make some tiny compromise in this relationship between you and your specialty? There are small compromises required, that, okay, I need to change my place from a tier 3 city to a tier 1 city and build my name there. It's like, why is more important? What is your why? Is living in that city more important to you, or your specialty more important to you? I think that is the call here. But
maybe maybe tele-radiology would play some role in that part.
Yeah, definitely, that is also one of the things. But like when you get into something which is highly specialized, like suppose you get into something which is highly specialized, which is happening only in a tertiary center, and you are highly skilled at it, you worked hard to acquire that skill, you worked hard, you did that degree, you worked hard, you spent time, then I would want you to it's like building a wall. Like suppose you build a wall till this level, that okay, and then you start building another wall, that okay, till yesterday I was becoming a cardiac radiologist, now I want to become a general radiologist, tomorrow I want to become something else. No building will not be formed. It has to be formed layer by layer, and when we do coherent growth, it makes more sense. Coherent means that if what I'm doing is adding on to what I've been doing previously, and I keep adding, so the building layer becomes good. So if you spend 6 years into learning cardiac imaging and then you go and you stop doing it, then it is time that has gone waste in life, I feel.
And any suggestions on how to network with referring physicians beyond, of course, cuts, but what are the other ways to, impress upon referring physicians? Any suggestions there?
Varun, you want to add?
Have a good PR team, I suppose, with the clinicians, and talk to the clinician regularly is what I feel. That would do the trick. Yeah.
Like I'll answer this question because I see when you become a radiologist initially and when you become a resident, what happens is initially we start thinking that, okay, my job is to write a report and their job is to treat patients. And sometimes I see young radiologists, they shy away from talking to senior colleagues on the counterpart. Like the radiology resident is happy to talk to his radiology consultant, but when he's talking to a neurology consultant, he's like little shy on it, or oncology consultant, he's little shy and he's like, isse kya main baat kar paunga? Don't cut that barrier. Learn that art young. Because when you are young, even if you speak something stupid, people will not mind. You're supposed to be stupid only. You understand? So when you are second year MD and you make a mistake in front of a senior consultant oncologist, it hardly matters. But get that hitch out of it. Speak out. Learn to speak. Start talking to people. You will build relationships. Relationship with referring physician, your own colleague, everything is dependent on communication. You need to talk. You need to talk. That is very important. And I think if one thing you can learn from our seminar today is, you need to talk, you need to communicate. You can know, even when you are writing a report, if you notice what Dr. Varun was doing, even when he's writing a report, he is trying to create a communication which is unique to his own style, that even if he has not signed it, the referring physician knows that these diagrams are his. Others are writing in paragraph he's creating. So your communication, verbal, non-verbal, written, you have to communicate a lot. You have to bring value for them. You have to solve their problems. If he feels that this CT needs to be done early, try to help him, try to get him get the report done faster, rather than looking at them as enemies. You will build good relations.
So that's one thing I think even I would second, is that residents somehow get the mindset is, I need to learn image interpretation during residency, baki sab main baad mein seekh lunga or seekh lungi. And be it this communication skills, be it entrepreneurship, right? As you said, when the MR machine is being bought, they don't look at that as an opportunity. They just try to report the MRs, and they learn the that technique, that art later on. Or even looking at how people make PowerPoints, like whatever it is. These are all skills which have to be focused upon during a residency, and not something which you need to look at as I'll learn this later on. And probably that's something people need to start working on during those 3-4 years of training.
Younger you are, you have more, actually freedom to ask anything that you want to, because, whatever you may speak will not be held against you because of your youth. People know that you don't know it. They will smile and go off, but you will learn to talk much earlier. I think that is very important.
So one more question actually, which I have, is that, is entrepreneurship something innate, or is it something which can be developed? Now I'm a first year resident. I have listened to your talk, and I'm now bubbling with, I want to do something, I want to become an entrepreneur. How do I go about? Are there books I should read, blogs I should read, videos I should see? Or is it something about just keeping eyes and ear open, and hopefully that should do the trick?
I think my feeling here is that whatever you're doing, whatever you're pursuing, try to do it to your best of your ability, rather than thinking of anything else. That, like, suppose you are a radiology resident and you're doing radiology, you're learning radiology in your hospital, try to do it with the best of your ability and deeply engage with it, so that you are able to see the problems. Once you start seeing that, okay, this, like I give you an example, like Varun saw that there is a problem that people are writing reports, but the referring doctors are not reading those stories that you're writing. It is better to give them a picture. They see, oh, tumor, pancreas, good. So he's trying to solve a problem. So that is the step number one of, innovating. And then he has to gradually reach to a level where it can be generally called as an innovative product, which can be brought to market. So it's like, but this will only happen when you go deep into it, when you're doing it every day. When you're doing it every day, you'll find, okay, there is a problem. You're doing it every day, you find, okay, there is a problem that people are not reading reports that we are writing, and that is truth. Many of the radiology reports that people are writing, the referring doctor is not reading all those 5 pages. There is truth. So then when you find it, there is a problem, you look for solutions. And you start innovating tiny by tiny, but then you reach to a level when, one day Varun decides that, okay, I want to make my own platform, which will help people generate structured reports in my kind of format. I'm giving him an idea. So now that becomes a product which can be, other radiologists can use as a SaaS, as a service. They can, pay per monthly and start using it. And it is all possible. So you solve problems. So what happens is, now what entire mindset needs to be fine-tuned, retuned into becoming a problem solver. I always find residents who become problem finders, who say, मेरे देश में ये नहीं है, मेरे हॉस्पिटल में ये नहीं है, मेरे वहाँ पे ये नहीं है, मेरे यहाँ वो नहीं है. उसकी जगह वो ये सोचे कि ये नहीं है, लेकिन फिर भी कैसे जुगाड़ लगा के काम चलाना है और ऐसा प्रोडक्ट बनाना है जो मैं आगे जाके उसको पेटेंट ही कर लूं. It's like you have to fine tune your mind from being a problem finder. आपने इसलिए नहीं रेजिडेंट बनाया आपको, या इसलिए नहीं डॉक्टर बनाया कि यहाँ हॉस्पिटल में क्या क्या कमी है आपने आके बतानी है. आपने प्रॉब्लम का सोल्यूशन ढूंढना है. And then if you find that this solution is big enough to be a product in itself, you can actually launch it. Like one of those is speech, I'm sure you all know this now, that earlier we were all typing. Now you can use that dragon and you speak it, and it's a problem being solved by a device and by an algorithm, and that becomes a product that people buy.
So I think Varun already has found an angel investor if he starts his SaaS, right? Right on this show.
Yeah, sure.
Okay, Varun, you want to take the next one? Is it okay if we go over time, Sumer? I mean, we have already gone a little over time, but we are really enjoying this, and clearly the audience is sticking, so they are also enjoying it. Is it okay? Like a few.
Maybe if anybody in the audience also wants to get into the video and ask it on the video, it would be fun.
So, yeah, so I mean, we don't have that option of allowing a non-panelist to.
You can click on the attendee and promote to panelists.
Yeah, we can do that probably. So if there's anyone who wants to speak and question something, which is not already covered, right? So not the same questions again. Just put on the Q&A and we'll try to make you a panelist if possible. But till then, maybe Varun, you want to ask one of the other questions which have come?
So yeah, regarding the future, many people were concerned about AI as well. So there are increasingly now super specialists tend to read our scans. They have the clinical input as well. They sometimes read it better than radiologists. So many people were fearing that, yeah, in the future, super specialists would read all our scans and radiology would not be as important as it is today. So your input on that.
It's like, if we don't improve in anything that we are doing, if we don't evolve, we become outdated. It is like not only in radiology, it is truth for everything that we are doing today. So we need to evolve, we need to learn. If you feel that more core expertise is required in your zone, you need to read more, you need to study more, remain relevant for the physicians that you are dealing with. Like it would always be different for, like suppose you are a radiologist where only a physician and gynecologists are referring patients versus where you have super specialists sending cases to you. Then you need to read and evolve to their level. It is not necessary that you know everything from birth. We cannot be born by knowing everything. I don't know. I always tell my referring physician that, you are asking something that I don't know, but give me time, I'll read about it, and next time I'll know it. And people appreciate this. Even if they are senior, you are able to learn. But learner, a mindset where you are happy to learn is very important. छुपना नहीं है कि मुझे नहीं आता मैं छुप जाऊंगा, ऐसा नहीं आता, सीखेंगे, आज करते हैं. I think one more question I want to take is because I see many people asking this. एक बच्चे ने पूछा, sir, should cuts be stopped? So again, you are looking to solve your problem by legislation or by government. So you try and understand. So suppose you feel that your practice is being affected by somebody else giving some cuts, and आप चाहते हो कि सरकार आके उसको सॉल्व करे. तो इंडिविजुअल लेवल पे तो सरकार आपकी नहीं सुनेगी, लेकिन एसोसिएशन जो होगी वो जरूर आपके बिहाफ पे बात करेगी, उसको डालेगी. लेकिन इंडिविजुअल लेवल पे तो आपने उस क्वालिटी पे पहुंचना है कि पीपल डोंट बॉदर. वो कहते हैं जैसे कि यार ये इतना अच्छा रेडियोलॉजिस्ट है, इसके पास में अल्ट्रासाउंड के लिए मुझे भेजना है क्योंकि ये बेहतरीन है. सो यू हैव टू रीच टू दैट लेवल इंस्टेड ऑफ, मतलब हर चीज सरकार नहीं करके देती है. डेवलपिंग कंट्री के अंदर मुश्किल होता है कई बार.
Very well said. So a couple of people, and this is all about you. So what is the secret of staying motivated? How to overcome failure? And then Priya is asking, what is your dream now? Are you satisfied?
Acha. Satisfaction and entrepreneurship don't go together as a personality trait. So I am not satisfied with whatever I have done. I want to redo everything. I want to improve upon it. And that is probably the secret of enthusiasm as well, because I want to learn the way of the new world. I 2-3 days back, I was on Twitter and I clicked on Twitter space and I saw, what is this? I clicked upon it and I started talking, and some people started joining in and we started discussing. I was so excited. And then it was around, I started at 10, it was till 1 o'clock in the night, and we are talking, and my wife is telling that what is happening. So I'm so excited that there is a new tool that is now happening in communication world. We are all talking about videos and Zoom, and today I'm digging deep into audios. And that's why I talked about this to Varun also, because audio is so impersonal and so easy to talk, and it is so easy to connect on audio versus always bothering how your video is looking like, what is the background, and all those things. Safai piche hui ke nahi hui and all those things. So I think that is a good idea, and many of you will be surprised that Facebook, now it started with Clubhouse, then Twitter Spaces started happening. Now Facebook 2 days back has launched an audio room feature, which is right now available in America, but it would be available in India soon. So like there are people, different companies, different people looking at similar idea, but bringing their own perspective into it, that this is how it should be used. So I think if you are excited about change, and if you look at every change, every failure as a learning opportunity, you will remain motivated and you will remain enthusiastic.
Yeah, regarding that audio part also. So as we record our lectures and all, we can always record our cases also when you are showing it to the clinician and send it directly to the clinician while you are speaking onto that case. So that can also be done. I was showing that to Akshay sir one day, and he also seemed to like that idea. Yeah, so that is very personalized to the clinician. Whatever relevant findings you have, you can show it in that video itself. You can record it on the screen. Yeah.
Yeah, so he had actually done a 3D recon of a very complex tarsal fracture, and he could, twist and turn and show everything on that video. So that was really amazing, actually. A few questions, Sumin, on AI. So if someone wants to go into AI as a profession, at least a side profession, where does one start? Where can you learn more about AI? I mean, do they take courses? Any thoughts or any knowledge on this? Or would that be another webinar altogether?
I think it's going into a different webinar now, but there are like free courses available on Udemy, and there are like, you can do a bit of search around. And I think if you really want to get into something, you will find ways. And it's like, don't look at anything as don't be a certificate hunter. Is like, sometimes I feel people become a certificate or a degree hunter. I'll give a separate example here. Like on our eMedicoz platform, we have a course for research methodology, where we have a total course on how a research should be done. And recently in one of the webinars, I was showing it to a European doctor that, see, this is how we have created a course in DAMS. And that doctor said, this is similar to what I get from Harvard at 10 times the cost. But then I actually submitted it to the students and the doctors. They don't buy my course because there's no certificate attached. People want a certificate more than the learning. So similarly in AI, it's like, whatever you want to learn, try working deep onto it. Try finding free videos on the YouTube, free courses. Then you can go on paid courses. But don't just become a certificate hunter, that I have 5 certificates with me and this. And it is just like a vanity. It's a vanity sale that is happening sometimes by I don't know if I'm able to place it right. Like, you do a program by X place where you are not learning something, but you get a certificate to showcase that, okay, I have a certificate. There's no value of those certificates that you have collected beyond a certain level. Like when you are at a level of people like Akshay or Varun who are practicing. Now what happens is, after a certain level, what is going to matter more is what you can actually do. What is your skill set, not just a certificate that you're collecting. So rather than looking at certificates, look for skills. Hands-on work with people who are into the domain is always I want to give you a surprising answer here also, that if you find that there is something that you like doing in AI, and you find some company who's doing certain kind of work, you should always write to them and say that, I am a radiologist out of India and I'm very excited about what you are doing. Can you take me as one of the observers into your thing? I want to work, I want to contribute. And also write that I am not expecting any name out of it, any money out of it. People will, because these kind of people are not available now. You learn, people will take you in immediately. You walk into any hospital in India and you say that I want to work with you for 2 months. I am not expecting anything. You pay whatever you want to pay. I am not expecting any, say name or, don't put my board. And I want to learn. There is nobody who would say no to you. There's nobody who would say no to you. You can walk into any XYZ person across the globe. You can follow them on Twitter, mail them, write in. You will find everybody will be happy to, take you in the team. And thereafter, it depends on what you do and what you bring to table. But don't ask for money at the first. That is important.
That's a fantastic answer. Varun, you want to take the next one? I think most of the ones now are pretty much covered by you, actually, aren't they?
Yeah, I think most of the questions which were asked are covered.
And quite a few Sumer are sort of pleasantly, happily reminiscing their DAMS days, NEET PG aspirants, and I've been grateful to your teaching, life lessons, podcasts, some in the chat box as well, and some on the Google Forms as well. or like proud
Yeah.
damn student 2013, proud damn student 2011. So clearly a lot of emotion attached to, you know, the experience in dams, which is more than what I can say for most of the classes I attended. I was not in dams, unfortunately.
Emotion is very important. I think, you know, like if you do something with heart and people connect to you, I'm grateful for the love that you know, I've gotten over the years, and that makes me more responsible also as an individual. I become more responsible when, you know, students send you love, and you know that, you know, you kind of, you need to do better than what you do.
Very true. Is there anything else, Varun, you can see that needs to be asked? So maybe you
No,
can
I
also
think
have
we have, yeah, I think we have covered almost everything.
okay. Anything, Sumer, that you want to cover? You know, questions.
I see one question by somebody saying how to tackle negative approach of referring physicians about radiology. By letting them know what you are able to do. Now I'll give you an example that I was like reporting a chest X-ray, and this chest X-ray had a nodular lesion, and it's like 5-6 years back, and there's this referral form saying known case of TB hemoptysis on ATT. Okay. But when I read the name and everything on when I'm reporting, and I saw, yeah, I saw this name earlier, and I remembered I had seen his brain also. So, and on brain also there was something like tuberculoma written, and then I started thinking, could these both be metastatic? And he was a 30-year-old male, and could this be metastatic? And then I called the patient, and I asked him that, do you have a scrotal mass? And patient, yes, I have. And so I called the respiratory, the neurophysician and the respiratory physician, that, boss, I worked up this entire thing that you had sent me an MR separately, X-ray separately. By chance, I saw both of them. I put them together, and I think this patient has a testicular tumor. He's a young male. And he said, what is your name? And that is where people ask you your name. When you bring value, what do we mean by values? Value is something that you're bringing to table which you have not been paid for. It's very important to understand. I was paid to sign off that report as known case of tuberculoma, follow-up, no serial interval change, known case of TB, on ATT opacity is decreased, whatever. I could have written it. But now when I bring value beyond what I have been paid for, people will ask your name. And now the referring physician knows that, you know, सब ऐसा नहीं है कि radiologist बेकार है, काम भी आते हैं. So he knows it. So now what happens is that every time he sees some tricky case, something that he feels that needs to be answered, Sumer, tu dekh ek baar. And so that is the value that you create. That is the respect that you, mutual respect that you create. And you also need to give mutual respect to them also. Many times, if a neurologist or an orthopedic surgeon has made a good diagnosis without in his own clinical thing, also in morning meeting, I would always tell them, boss, you know, बहुत बढ़िया आपने तो जो बोला वही निकला है. So mutual respect. You give mutual respect, they will respect you. Don't ये बिल्कुल गलत मानना है आपका कि रेफरिंग फिजिशियन सोचते हैं रेडियोलॉजिस्ट कुछ नहीं लाते टेबल पे. ऐसा कुछ नहीं. उन सबको पता है कि किसका क्या काम है. ऐसा इसको बिल्कुल आप ना, बिल्कुल अभी कई बच्चे डर भी जाते हैं कि रेडियोलॉजी में ऐसा क्या होगा, इज्जत ही नहीं मिलेगी. ऐसा कुछ भी नहीं है. रेफरिंग फिजिशियंस नो what a radiologist brings to a table. It's very important.
That's the best definition of value I've read, Sumer. I mean, just hats off to you for, you know, as you said, the simple, you know, something which everyone can understand. But probably this is the actual definition of value. But you know, value brings us to this last, I think, thing which we forgot, and that is teleradiology. And many people feel that, you know, we bring value, but somehow we don't get equal value back in what we, you know, get charged on teleradiology. Your take on teleradiology? And I mean, it's here to stay, right? Not much we can do, but whatever, you know, your 2 cents on it.
I think overall, what would happen is gradually we have to evolve the product that we are offering as a radiologist. Like, let's imagine teleradiology for a second. Now, suppose Dr. Akshay or Dr. Varun is reporting a CT scan in his own hospital. Now, when you're reporting a CT in your own hospital, you have relationships also. You have a surgeon who knows you, orthopedic surgeon who knows you by your name and everything. So even if you make a mistake in your report, you know, it is overlooked because they know, yaar, iska legacy hai, to bhai itna acha karta hai, ek aadhi baar galat ho gaya, koi baat nahi. But when we go to domains like teleradiology, your personality is stripped off it. The only thing that remains is the report. And now, everybody wants more money out of the reports, and we all believe that we are more valuable. But when I look at the report that people are writing, and I'm sure you must have seen a lot of teleradiology reports also in your own practice also. A lot of them are actually not even at that standard to be called as a report, because you have to look at it like, as a radiologist, you have to bring, as a person, you have to bring your signature onto your work. That means if you are writing a report, it has to be yours, your quality on it. ऐसा नहीं कि tele में कर रहे हैं तो यहाँ पे 2 line लिख दी है, ऐसा नहीं. So once that product evolves into a product in itself, which does not needs to be cross-checked by the on-site radiologist again and all, then the value proposition might improve in future. But as the reason is, like, most of the places I see that some teleradiology services reporting and in-house radiologists are re-reporting it, and they are not happy with the quality of reporting, and the diagnostic center, the referring physician to that diagnostic center are not happy with the reporting quality. Then you have to make yourself not replaceable. When you reach to a level where the hospital or wherever you're providing your services, they feel that this guy is not replaceable, he's so good, and then you are able to get into the premium payment brackets. This is what I feel. And second is, another opportunity that I feel is, there could be a future in teleradiology where there could be a free marketplace where you could have, say, 7 doctors listed here, or 10 doctors, like Dr. Sumer, Dr. Akshay, Dr. Varun, or A, B, C. And we would say that my value for time is this. And it is written on the side. And there could be patients who might later on come to you for second opinion. They could match and see your profile. Okay, 10 years experience, 5 years. Okay, this is the guy that I want my reporting, but he is going to charge 2,000. He is going to charge 100. I'm good. So there might be a place in future where a patient, because the patients are also getting more and more aware, would seek second opinions from people of his choice. And the report and the doing MRI and doing the report in India, they are like a bundle. Let me try to explain it to you. Like India, what is happening is, you get an MRI done in the hospital at maybe 8,000 rupees. It is for granted that a report will also come with it. So it is a bundle of service where a report, imaging and report is bundled into it. There will be a time in future in India where a patient who is well paying would say that I am not happy with what I'm getting in the bundle. I want a premium. I want a second opinion, third opinion. I want a report from people like Bhavin Jankaria. I want a report from, maybe people at the top, Ravi Ramakant. I want top-notch onco radiologist to answer my report. Now, when there will be a point where somebody will look at this as an opportunity, some entrepreneur, and will create a marketplace. This marketplace will register radiologist, and it will ask that you write your profile, 1 line, 2 line, 3 lines, most important things about you, your experience, any publications in any domain, expertise, and what price do you want for a report, and what is the turnaround time you will give to the patient. And there will be a platform which will take the cut out of it. Okay. This is possible.
Yeah, people I think have already started doing that. I guess Innovation Imaging in Mumbai has started doing that. They have made a link on which you can upload your case from a CD or a DICOM file and get a second opinion.
I think that
they charge you for that.
Again, that second opinion is restricted to that. Like I am talking about an open marketplace where everybody can join in as an expert, bring in their expertise. Suppose I am good. I have seen like 20 cases of high-rated cyst in bone. So I put that expertise that, anybody who has a high-rated in bone, I am the man who's seen 20 cases, but I will reply at 5,000 rupees at 30 minutes of report. I will not give my time at less. So this kind of marketplace would evolve, is what my feeling is.
So that's interesting. When I was in Seattle, there was a guy called Douglas Green, and he had actually written exactly on this, the Uber for radiology in radiographics. It's a beautiful article if anyone wants to read. And I'm pretty sure that will happen soon.
Anybody wants to do it and wants to, me to put in some investment, I'm happy.
So maybe you're making us feel like, we should leave what we're doing right now and get into some more interesting stuff. But, I think this is a good time to end. And, this is a question someone has asked. You want to be remembered as a radiologist, a teacher, an entrepreneur, or all of them together. And it's very clear that Sumer is good. I mean, he will be remembered as all of this and much more than this, right? I mean, irrespective of what he wants to be remembered as, because it's just fantastic. Like the way you have answered everything, it was all clear in your mind, right? It's all well thought out. It's all articulated. And you have this personality where everything is already organized in your mind. And it's just amazing to, listen to you. I do hope that we have more webinars by you in the future on such topics. And I don't know. I mean, I don't know how I can thank you enough, how we can thank you enough for this. You spent pretty much 50 minutes extra to answer all these questions. But really, I think all the people who attended it have taken a lot back. And I'm sure that will reflect in their practice in the future as well. Varun, you want to add anything? I mean,
No, I think you both have covered everything. And almost this is like the longest webinar I have attended.
I like to compliment Akshay on the idea that he is to pitch to me that we need to talk about this, and I like this something different idea on Saturday. I think there are so many things that I like about this entire concept, and what I truly want to when we close this session today, if we are able to help you see your own self better through a webinar, I think our purpose is solved. Like it is like I like somebody says that what should I be remembered as, or what should Akshay want to become? It is what Akshay will become is his own game. What I will become is my own game. What you will become is your game. And if we are able to, as people who have seen little bit more life than you have, if we are able to fine tune it a little bit, and maybe reassure you that you are going on the wrong direction, or we are able to fine tune your mindset. Maybe you were becoming too cynical. Today I see a lot of youngsters becoming too negative about everything. India खराब है, देश खराब है, कुछ भी नहीं हो रहा यहाँ, and बाहर से लोग आके investment करके सब यहाँ बना जाएंगे, है ना? हम अपने बात को खराब करते रहे. तो वो मुझे लगता है अगर वो हल्का सा वो हम change ला पाए mindset के अंदर, I think that is what I want to be remembered as. कि sir, you made a difference in my life. That is what I want. Thank you very much.
Yeah, as usual, again, perfectly put. The webinar should be renamed Kung Fu Panda, sort of, because that's what most of us will now feel like, right? To discover the Kung Fu Panda in you. Yeah. So thanks a lot, Sumer, and thanks a lot, Varun, for the time that you have given. It was really a pleasure. I think this was the webinar I've enjoyed the most amongst our, I think, 280, 290 sessions till now. And probably every, the fourth Saturday, I'll text you the topic for, Sumer. Maybe you'll want to have a look at a few of them as well. So thanks a lot, and have a good evening. I mean,
it was an honor. Yeah.
Thank you everybody for joining in and patiently listening to us. Bye everybody. Take care of yourself and take care of your loved ones. Take care. Bye.
Yeah.
So you'll have to end it with Sumer because you are the host.